Hi, I'm Trish. I haven't seen you for a while. I got a new phone a few months ago, and the phone is really great, but the video is really shit on it. And if you have a look at my last couple of videos before this one, you'll see what I mean. And I've been, I got a new, well, my son upgraded my computer, did something to my computer, I don't know. And I don't have the movie making software that I used to have, so I've been struggling to find something that I can actually use. So I actually did make a video a while back on my new phone, and it was so shit that I just deleted it. So here's my news now. As you can see, I have gained a shit ton of weight, a shit ton. When I had my tummy tuck done about 18 months ago, roughly 18 months ago, I had gotten down to 82 kilos. That wasn't a sustainable weight for me, but I had to do that for the tummy tuck and blah, 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 blah. My usual weight was, I can't even remember, maybe 90 kilos, and I was very happy with that. So, you know, after the surgery, by the time he took all that skin and crap off me that I didn't need, I would have been about 79 kilos. Now, I never saw that 79 kilos on the scales because by the time I got home from the hospital and with swelling and, you know, fluid retention and everything, I think I was about 82 kilos when I got home. But I know immediately after the surgery I would have been about 79. And today, only about 18 months later, I'm 122. I am happy with how I look. I look fine. I've never had a problem with that, even when I was a very, very big girl at 170 kilos, but I feel a bit shit. I just feel really sluggish and just uncomfortable in my body, but it's got nothing to do with how I look. I quite like how I look at the moment. Except across here I've got a bit fleshy and my face has gotten fat again. I can't say I don't like it or that I hate it or I hate my body or anything, but that I prefer when there's not as much weight on there. But I'm still overall very happy with how I look. If you want to see how I look, I'll show you. This is me now. So I'm very definitely a big girl. But that doesn't bother me. I still like it. So yesterday, this is why I'm making the video anyway, after saying all that shit. I yesterday went to the Alfred for my pre-op clinic appointment, you know, where you go and see everyone in the hospital. I was there for 3 hours, which isn't too bad because they said to allow 6, which I would have gone insane if I'd been there for 6 hours, but I wasn't. I was only there for 3. And I saw, I've got my little cheat sheet here, this is the one that they gave me in the hospital. I saw the nurse. She just went over things like my blood pressure, and she did an ECG, and, you know, they just go over, you know, what's your weight and your height, and I think that's around about all she did. And all that checked out. My ECG's fine. My blood pressure's fine. My blood pressure wasn't fine when she checked it. It was like 150 over 90 or something, but when they do the blood pressure in there, I don't want to say that they're not doing their job properly, but so many health professionals just don't know how to do blood pressure properly. You know, like they'll put you up on a bed where your feet aren't touching the floor, or they won't have your arm in the right position, or they use the wrong size cuff, or they talk to you while they're doing the blood pressure. Now, you're not supposed to talk or be spoken to when you're having your blood pressure done because it affects the reading. And so she was chat while she was doing the blood pressure. And so then I was, you know, chat back. So my blood pressure was quite high. I've got my own blood pressure machine here at home. I check my blood pressure every couple of weeks. And I do that because I do have a lot of anxiety with my health, and in particular my heart, because there's a lot of heart disease in my family. So I thought I'm just going to get my own little blood pressure machine so I can keep an eye on it and reassure myself that I am actually okay. So I know when I check my blood pressure at home, it's perfect. It's if anything, slightly lower than than perfect, which is even more perfect. So I wasn't worried about that reading. She didn't seem to be too worried about it either. I also saw the pharmacist. She just went over my current medications, let me know that I could still keep taking what I'm taking now. And there is a medication I'm on at the moment for my periods. I have to take a medicine to make my periods stop, essentially, before I bleed to death whenever I get a period. So she looked into that, and she said as long as I've not had it for a few days prior, it should be okay. But if I get my surgery date and I get my period within a week before then, I'm just not going to take it. I'm not going to bleed to death with one period. So that was fine. Who else did I say? The anaesthetist. The anaesthetist remembered me in great detail, and I have not seen him since August last year, but he remembered me. He remembered that I'm a phlebotomist, which I always find a little bit embarrassing because, yes, I am. I did the course. I have a certificate that says I'm a phlebotomist, but I never worked as a phlebotomist. I wasn't able to. I did all of that study, and then went and did placement and realised that it wasn't a job I could do because I would be on my feet for hours at a time, and I've got too many back problems. I've got 3 bulging discs and lordosis, kyphosis, scoliosis, and I can't do that job without chowing down on some really, really strong painkillers, and I can't do that job if I'm taking really strong painkillers. It's just not, it's not practical. I was heartbroken because I love that. You would not believe the buzz I get out of sticking needles into people. So, but anyway, he remembered, and I don't even know how they know that. I must have mentioned it sometime. I don't know. It was probably a throwaway line when they were sticking an IV into me 6 years ago, and I said, oh, this shouldn't make me nervous because I'm trained in sticking needles in people or something. It was probably just a throwaway line, but they've remembered it. They've written it on my file somewhere probably. So yeah, he remembered that. He remembered that I have very difficult veins. He remembered that I was very anxious. He remembered that they had to get the ultrasound machine out to try to find my vein. And he also remembered that he had to be careful with my eyelash extensions, and he actually asked me, or actually he noticed because my eyelashes are pretty out of control at the moment. He said, he asked me if I needed him to be careful with my lashes again. So this is shaping up to be a super great video because it's already cut out. Yeah, I'm hoping that he remembered me purely because I have purple hair. Not that many people have purple hair. Who else? Oh, and I spoke to him as well about the whole anxiety around the IVs. Now, I don't mind having needles stuck into me for IVs, but I'm a very, very difficult patient because my veins are crap. I used to have a really good vein here, and that one's still fine for blood tests, but for IVs it's no good anymore. It's just much too scarred. They can't advance the plastic thing that goes up through the vein. So, and then of course anaesthetists always want to put IVs in my hands, and I don't like to say to anaesthetists, look, it's not going to work because, you know, like they're professionals at this, but I've had enough IVs and enough surgeries to know that my hands don't work. Even if they manage to get a needle in to, like, behind in the back of one of my hands, it tissues, and then every time they push something through, even saline, it really, really hurts, and then I end up with another one because they go, oh, well, that one's not working, we've got to do another one now. So in recent months I have learned that I've got a reasonable vein here that they can use, but it really hurts. So anyway, they always misunderstood me and thought that I got really, really anxious about the surgery, and I do, but by the time I get into theatre, they've got an IV in and they've given me midazolam, and I don't give a rat's ass what's happening anymore. You give me midazolam, nothing matters anymore. So I said to him, could you please, I don't get anxious about going into theatre, I get anxious about the IV, and there's no point giving me midazolam through the IV because, you know, it's already over by then. So could I please have midazolam orally before you even stick anything into me? And he said, yes, we can do that. So that's a massive, massive relief for me. So I've got that sorted out, and he's a really lovely bloke too. Really, really lovely. I always find anaesthetists are really lovely. Maybe I should marry one. Not him, but an anaesthetist. I also saw the doctor. The Alfred is closing down their theatres for 3 months from January to April this year, 2019. But their surgeries are still going ahead. They're just doing them at the Epworth in Richmond. So as long as all of my blood tests come back okay and the surgeon is happy to go ahead, I'll be done at the Epworth. Hopefully the end of February or in March sometime. I'd prefer in February because I'm gaining so much weight and I'm just getting really anxious about it. But even if it's done in March, you know, it's the end of January now. It's not an eternity to wait. So, yeah, as long as the surgeon gives the go-ahead for me, I'll be done at the Epworth. And all of the blood test results were back except for ferritin. And she said if ferritin, which is iron, was below 50, then I would have to have an iron infusion first, so that would put it back a couple of weeks. But I'm very confident that my ferritin will be well over 50 because I had an iron infusion just in December, I think, a couple of months ago. No more than 3 months ago. My memory's a bit shot. And I know from previous experience... Phone cut out again. What a surprise. Yeah, it takes at least 6 months for my ferritin to drop down below 60, I think it was. I can't remember, but my ferritin's going to be fine. And I think that's around about all she said. And I might be getting cross over here because that might have been the coordinator as well. Oh, and I have to do Optifast for 2 weeks. My BMI at the moment is 42. If it had gone up to 45, then I would have had to do Optifast for a month. And I'm not doing Optifast. I spoke to the dietitian called me because she couldn't be at the clinic appointment, so she called me the day before. She's just lovely. She's wonderful. I love this dietitian at the Alfred. So I'm going to be doing very strict keto. Essentially, all of the same veggies and everything as I would have with Optifast. No fruit, no dairy. 1 teaspoon of oil per day, which I can either use in cooking or in a salad dressing. And instead of each Optifast product 3 times a day, I have 90 grams of protein in the form of white fish, chicken, beef, lamb, turkey. I'm allowed up to 2 eggs per day, which would be a meal. I'm allowed canned tuna. They normally say absolutely no, but I'm allowed to, as long as I look on the can and make sure it's tuna in spring water and that there's no added sugar. And that's the tuna I eat anyway. And I'll make another video closer to the time when I start to do it. With that list of foods, I am not going to lack for anything. There is so many different meals that I can make with that range of food. I'm so excited. My daughter's excited. She's doing it with me, but obviously she'll eat at least twice as much as me. And who else did I see? The surgery coordinator. She, a bit of crossover back there, she just spoke about having the surgery done at the Epworth and the blood test results and, you know, Optifast and all that sort of thing. Not Optifast for me, but keto. So that's it, I think. And, yeah, as I said, I'm hopeful for a surgery date towards the end of February. I told her the 13th of February would be great because that's my birthday and I would love a birthday surgery. And she said, no, the surgeon who's going to be doing my surgery is away then. I said, oh, that's a shame. I said, how about the 28th of February because that would be my lap banding anniversary. And she said, oh, and she looked it up and she said, no, we don't do surgeries on the 28th, but, you know, we do on the 27th. So cross your fingers for me that I get the 27th because I love dates and numbers and all that sort of stuff. That would be really, really cool. And it would also mean that I don't have to wait till March. which means also, if I get a surgery on the 27th, I'll be starting Optifast on my birthday. Yeah, well, not Optifast, keto. I'm fine with that. That would be exciting for me. And I think that's all. I'll make another video with all the recipes and stuff that I'm going to be using. And I might even do on my Faddish on Facebook, because you can do stories there. I might do like a story each day of everything I'm eating if people are interested in that. And I think that is all for now. I'm very, very excited. I feel like things are moving ahead now. And that's all. I will talk to you soon.